Aortic valve stenosis, or narrowing of the aortic valve, is a disease that happens as we grow older, making it very hard to open. The heart has to work double time to push blood through a very tight valve.
Typically, people who have heart valve disease experience shortness of breath. They can also be fatigued, have swelling in their legs, chest pain. Here at UI Health, we have a comprehensive structural heart disease program where we provide patients with all forms of surgical intervention for valve disease and also minimally invasive techniques.
In the past, treatment used to be open heart surgery to replace the valve. Transcatheter aortic valve replacements is a new therapy that provides hope for patients too sick to undergo open heart surgery. Here at UI Health, we have an excellent team of physicians, very wide spectrum of knowledge and expertise, and we work together to get the best results possible.
Learn more about the structural heart team at UI Health. Visit heart.uihealth.care.